Good morning, friends. Welcome to MedWell Unscripted Live, Florida. I'm so excited. We have a special guest here today. And today we're talking about what is vaping and 5 things you should know for your wellness. Really excited. And I just want to do some housekeeping, friends. First of all, our lovely Kayla, who is always a rock star in our chat, is here in our chat. We are streaming this live to Facebook and YouTube, and it is being recorded. So if you are catching the replay of this, please do feel free to leave a question and comments. We will absolutely get back to you. And for those of us that are here live today, definitely make sure that you drop questions along the way because we want to make sure that we answer them. So let's get started. My name is April, and I'm going to introduce to you Nicole Stewart, our Director of Community Outreach here at MedWell Health, and also Maggie Norden, the Supervisor of Retail Operations at Columbia Care, Florida. Good morning, ladies. How are you?
Good morning.
Hello. Good. All right. So I'm going to start with some introductions and have Nicole share a little bit of her role, about her role here at MedWell and how she's rocking it in the community, sharing all about medical marijuana certifications and all that cannabis can do for wellness.
Absolutely. Hi, everybody. Good morning, and thank you for joining us. We're very excited to have Maggie here with Columbia Care. So my role with MedWell is, of course, community outreach and relations. So I go out and educate the public on the use of medical cannabis and how it can improve their lives. I travel all over, from St. Pete to Bradenton, Sarasota, all over, spreading the word and getting our name out there and showing them what we can do.
Awesome. And I am in the green room. So, friends, I'm in Connecticut where it's already cold, but I heard that Florida's having a little bit of chill down there right now. So, woo.
All right. One day it's back to normal a little bit, but appreciate the cooler weather for sure.
We actually have already had snow up our way, so that's crazy. All right, Maggie, share with us your role at Columbia Care.
Well, hi guys. I am so honored to be a part of this. I love to get out in the community. I am, as mentioned before, I am the Supervisor of Retail Operations here at Columbia Care in Bradenton. And I basically oversee everything in the store, make sure that our products are being sold correctly, our patients are being informed correctly, and really just kind of creating the best product knowledge that we can possibly give to our patients.
Awesome. All right. So today we're going to be talking about vaping, friends. And, I think there's lots of questions around it. And there's also some concerns in terms of health and wellness. You hear kind of in the past, some states have actually put bans on vapes. I know that's not the case in Florida. So we really want to share with you some great information that you can kind of make a determination in your wellness. So Maggie, can you talk a little bit about what is vaping? Because I think some people, you hear smoking, vaping, all these different things. And I know we have new patients that come to us, and even patients that have been using cannabis for a long time don't actually know what the difference is.
Absolutely. So I think the basic, easiest way to put it is that it's merely just a different way of consuming your cannabis. You can vaporize cannabis, the flower, or you can also vape concentrates as well. The difference between smoking cannabis and vaping cannabis is that you aren't going to get a heavy smoke, but rather you're going to get just the vapors from the product that you are smoking. It tends to be a smoother, a cleaner smoke that is usually also with a higher THC potency.
Okay, awesome. And, what is kind of the difference between vaping and smoking?
Well, so vaping, you get the vaporized product. You're smoking vapor. You're not smoking the smoke that comes from the product, whether you're smoking it from, say, a bowl, or if you even used a paper. You're just getting the pure product in vapor form, not in smoke form. So it's easier. It tends to go down smoother. It tends to really just be an easier smoke, maybe even more lighter than a smoke that you may get from a joint or that you may get from just smoking flower in general.
Okay. And in terms of vape products, so there's different types of concentrates, right? That actually you put in a vape pen, and then my understanding is you can buy a vaporizer, but then they have disposable ones. There's all kind of different elements.
There's really so many options, and it can get really confusing. But it really is simple if you just slow down and pay attention to what it is that you are wanting to achieve. So a general vaporizer is just going to look something like this. You're going to have a cartridge that connects to it. And generally what you buy from your dispensary is going to be this product here. You should already have a battery, or your dispensary will provide you with one. But this cart here is what you will be vaporizing from, and will have your product in there that you will be vaporizing. That being said, you do also have different types of vaporizers that you can utilize with different types of concentrates, such as shatter or rosin, crumble. There's all different kinds of names for them, but they are used in a different form that are specifically for vaporizing, and the temperature that vaporizing has that's different that you would use if you were just smoking cannabis, the plant.
Okay. Awesome. That was super helpful. And so when you talk about, can you get like hybrids? Can you get sativa, indica, all different types of cannabis forms?
Yeah. So here at Columbia Care, we have kind of created indica dominant blends that are not necessarily specifically designed per strain, but rather to give you the ultimate relief, and that's called full spectrum. But you definitely can get all different kinds of strain-specific vapes depending on which dispensary it is that you choose to shop at. They could do indica or sativa. They could do hybrid, as you mentioned, but they could also do strain-specific, like as in maybe like a heavy indica dominant, like Granddaddy Purple is a very common strain that people will vaporize to help for relaxation, for sleep. Granddaddy Purple is a great strain for sleep. So vaporizing that, and I think the really important part, April, to really focus on is that the onset of it. That's why these concentrates and these distillates and these full spectrum vapes are a little bit different, is the onset of these products versus smoking cannabis just directly.
Perfect, which kind of leads me into that next question of how long does it take to, kind of feel the effects of vapes?
Yeah, so obviously everybody is different. Your cannabinoid system in your body is different, but the general onset is 15 to 45 seconds. And so that's why a lot of our patients
that's pretty quick.
Exactly. And that's exactly
why I love it.
Our patients will choose a vape because, capsules and tinctures, they're great products, but they're a longer onset period. If you're in pain, if you're having muscle spasms, I personally vape CBD. I really love it. If I'm feeling a little bit more stressed, I vape my CBD because I know that in 15 to 45 seconds, I'm going to start to feel whatever it is that I'm trying to maintain or not necessarily fix, but put on the mend,
Sure. And when you vape, how long? So that's amazing that it's such a short amount of time to relieve pain symptoms. And I know like edibles, if you take an edible, the consumption, it takes longer to take effect, but it seems to last longer. So how long does it, the effects of vaping last?
So that's the difference, absolutely, because if you take it through your digestive system, yes, it does last a lot longer. That being said, when you vape your product, it just depends on the dosage that you are consuming. Now, generally, I would say that the high should last, the effects should last for at least 30 to an hour, 30 minutes to an hour. That being said, it also depends on again, how much you are dosing. We recommend that when our patients start vaping, they start low and slow. We give them actually a packet here that helps them kind of start. Okay, I started at this level, I started with this dosage, because really everybody has to find their happy place. So for me, I'm usually good with my CBD if I take around 4 puffs. I have had patients here who will vape a higher THC vape who are just in chronic pain, and unfortunately they do have to vape it pretty constantly throughout the day. That being said, it's not unfortunate because it helps their pain and it helps it fast and it gives them that relief. So they may be smoking on it a little bit longer, but that's also part of the great aspect of a vape, is that sometimes people enjoy the part of just kind of smoking and relaxing. And so it's kind of that entourage effect that not only you get from the product that's in your vape, but also just kind of like the whole process in which what works for you best.
Which kind of, that's thank you. I think what would be helpful. So, we have patients, and I of course you have all age demographics that walk through the door. Can you talk a little bit about so I have asthma, so vaping for me is not a good choice, but like if I were to come in as a patient, what would I expect in you helping me kind of determine? So you said low and slow for dosage, like what would the process be of helping me determine that vaping was a good choice for me and kind of finding that right dose for whether it's based on my ailment or, like whatever my pain is?
Absolutely. So first, I'm always going to ask the patient what they've discussed with their doctor and what their doctor has suggested for them. That being said, if they have the route of inhalation on their recommendation, then what we talk about is, okay, what ailment are you experiencing? And again, is it something that we need to get under control right away? Or is it something that we necessarily maybe need to just prevent, in which case then a capsule or a tincture could work because the onset is differently. If a patient comes to me telling me that they have a lot of muscle spasms, trouble with sleep, or even something just as simple as anxiety, because there are CBD pens out there are CBD vaporizers out there. Those are things that you're going to want to take care of right away. So if you are able, if you are, you do not have asthma, because just like you said, I absolutely would not recommend, if you do have asthma, vaporizing. But if you are okay with smoking and inhalation, then if we're trying to fix something right away, then vaporizing is absolutely the way to go for sure.
And is there like an ideal ailment that would relieve, like a cancer patient in pain? Like, do you find that when you have patients come in, there are certain symptoms that kind of react better than others?
Yes, absolutely. So here at Columbia Care, we are a little bit different in the sense that we have our Clariseed, our Eliseed, and our Theraseed. Break it down really slow for you. It's really just high CBD products, a 1-to-1 ratio, or a high THC. So generally, it's very easy for me to understand what my patients are needing. If they need something for pain relief, it's going to be that Theraseed, and I'm going to go ahead and talk to them about what dosage might be best for them. If I have somebody who has muscle spasms, I'm a patient myself, and I have stomach muscle spasms, and so I use a vaporizer. Generally, either our 1-to-1 because of the entourage effect of the CBD with the THC, or just our Clariseed, just the CBD. And that generally helps my stomach stop spasming because of that fast onset. So digestive issues, it helps very well with. Pain would be a high THC. Or then when you get into strain specifics, sleep. If you're ready to go to sleep and you don't want to wait for a capsule or a sublingual to work for you, go ahead and get something that is a nice high indica, something that's really going to kind of calm and relax you. Here at Columbia Care, I use our Clariseed. It's nice and relaxed, couple puffs before bed, and I sleep like a baby.
Awesome. You've talked, so earlier you mentioned that if you're stressed, sometimes you're using vapes with just CBD, and then you have the others that have THC in them. Can you kind of talk a little bit about the difference between the two? Because I know, we have a lot of people on that are getting started, also really don't know necessarily the difference. And, you talk high THC, lower THC, or just CBD oil. What's the difference between them?
Absolutely. That's a really good question. And I think it's something that people really need to know the difference about. The high THC is going to be a potency that is usually 70% or higher. You definitely want to make sure that you're asking your med tender when you are buying a vape, what is the potency, so that they know what to expect. Some dispensaries are different than others, and so they need to know what to expect in a high THC product. That being said, they also need to know that if the high THC, is it going to be psychoactive, or is it going to be just helpful for the pain? Again, here at Columbia Care, because we have the full spectrum, it's the full plant matter. You don't really have so much of a psychoactive effect, but you just have more of that pain relief, that relief as to whatever ailment it is that you're trying to get to. That being said, absolutely love the question about the CBD vapes, because they have saved me. We have a 20-to-1 ratio, and I love it. It really is fabulous for taking down that edge of the day. It really helps with the inflammation in my body, and it really helps with the kind of tension that I experience as a patient through my gastrointestinal issues. It is very calming. It's very soothing. And we have that in also distillate form. That's the best part, is we have a full spectrum form, which is the full plant extract. You have all of the great capabilities and quantities and great possibilities of the plant in a full spectrum. It's a little bit darker. It's a little bit earthier tasting. So it's not always for everyone. That's why we also have a distillate version of our vapes, and that is cooked out more so that it's a cleaner product. It's a little bit more of a honey color, sweeter flavor. But that being said, the ratios are really, really important. And they're important as a patient to be asking your med tender what the ratio of your vaporizer is, what the potency is. And then if you are to get a 1-to-1 ratio, that means that you're going to get the same ratio of CBD to the same ratio of THC. And here in the cannabis world, we call that the entourage effect. When the CBD works with the THC together, they have the utmost capability of curing your ailments, or really, really making a difference to fixing whatever it is that you are feeling. And so that's why we really try to get our patients to understand that you can vape CBD too, and you can vape CBD with THC to get that really awesome medicinal effect.
Great explanation. I love the entourage effect. That was a perfect analogy. So one of the things that came to my mind as you were sharing, you see people that are there's other businesses that are just selling CBD. So they're not selling, any products with THC. They just have CBD. What's the difference if I'm to come into the dispensary and get CBD from you as opposed to somebody else? Because that's just a question that came to mind, and kind of
Absolutely.
What the difference, because I know clearly because of who you are and all the things that you go through in terms of the laws of Florida, I'm imagining it's a lot different than if I were to buy CBD cream in a different store. Not to say that it's not good, it's just probably different.
Absolutely. And that's a really great question. And it's a question that we get here often in our dispensary as well. Patients who have gone and tried those creams, those topicals, oils, whatever, the difference, the biggest difference that I can't stress enough. What you are buying from the stores that are not a dispensary is from the hemp plant. It is not from the cannabis plant. So you have different milligrams and you don't have the full medicinal aspect that the cannabis plant has to offer. Let me give you an example. If you buy a cream or a patch at a store, a CBD store, you are going to find a high strength patch at probably something around 14,000 milligrams. If you come into a medical marijuana dispensary and you want to get a patch that is a CBD patch only, I personally wear them all the time. They are so unbelievably helpful to my anxiety. It has absolutely changed me, and everyone around me speaks so highly of it. But the thing is, the medicinal cannabis plant has those differences, has that milligram that you only need 10 milligrams to make that difference. The hemp plant needs so much more. The cannabis plant already has those medicinal aspects in the plant. So the CBD that you are going to find being a medicinal marijuana card holder is going to absolutely be stronger and more effective than the CBD that you are going to find at a CBD store that is going to come from the hemp plant, not the cannabis plant.
Interesting. Thank
And
you.
That is a big question we get. It really is.
Let me add one more thing, which I always get this question asked all the time. Why should I get my card when I can just go get CBD? Because everybody knows CBD works so well, right, Maggie?
Yeah.
So I always say if you add that little bit of THC in with the CBD, it compounds it to work so much, just as you said, mirroring what you just said, it's night and day. So when they do come to the dispensary and actually try it, it is a completely different effect.
I've had some really great customer testimonials, patient testimonials that have tried our CBD vapes or have taken our our advice to try some different topicals or some different patches and try that entourage effect, because really that's what the plant is made for, is to get all of it in together and create that entourage effect. But yeah, it's kind of my goal to open people's eyes to CBD, because it has absolutely transformed my life as a patient, and I feel blessed every day to work with patients that have taken my advice and have found relief through that.
It's a great feeling. Great job, Maggie.
It is. It's the best.
Isn't
really
it?
Cool.
I know.
One of the questions that comes up a lot is, what's the difference between a dab pen and a vape? Can you elaborate on that?
I can, and I think it's also another important aspect of vaporizing to focus on, and to kind of make sure that you delineate between the two. We talk about vaping through a pen like this. Convenience, very easy. The thing about dabbing is you are going to need a different apparatus to vaporize from. So generally, someone is going to dab from what is called a dab rig, or they can use a vaporizer that is specifically used for concentrates for vaporizing. Concentrates that are generally vaporized are shatter, crumble, wax, butter. There's so many different names to them, guys. Every dispensary has different.
I think we need a list of all the slang.
There's so
Like,
many
just throwing it out there.
What I will say is that the biggest thing is temperature and consistency.
Interesting.
Consistent. Let's throw a third one in there too. Potency. So temperature, it's going to be heated at a different temperature than your ground flower would be heated at. Consistency. When you talk about all those different products, shatter, crumble, butter, they all have a different consistency. So you are going to use some other tools, such as a dab tool, to just take off a small, usually grain size of rice to start with, of those products, and put them into your vaporizer and start that way. So instead of buying a cartridge that has your product already in it, you're actually going to be buying your concentrate and then adding them to your vaporizing apparatus that can dab as well. The important part about it also is the potency. Generally, you're going to have a higher potency with what you are dabbing, again, than what you are smoking with general flower. So it's very important that when you are getting into vaporizing, dabbing, that you are asking your med tender what the potency and what the ratios are in the concentrates that you are getting. Also, they do have concentrates that are CBD. So if people really want to get a nice CBD feel, calm in their body with that really fast onset, they can get a concentrate that is a CBD strain.
Wow. Lots of
There is
information.
a lot to it. There's a lot to it.
No, and I appreciate you've explained everything very well.
Thank
So
you.
I want to talk a little bit about this silly and never-ending pandemic that we're in, and talk a little bit about kind of the patient experience. So, like at MedWell, we do whatever we can to educate our patients on kind of that next step when they leave their appointment into kind of walking into the dispensary. So can you talk a little bit about what Columbia is doing in terms of COVID precautions and what people can expect when they come in particular to that kind of that new patient experience? Because I know, some people are fearful of walking in the door. Is there a phone call before they come in? How does that work?
So I'm really glad that you asked that question, because we are extremely flexible here at Columbia Care. And I think that has been the best way that we can go about this crazy world. We don't know what's expecting, but the reality of it is my comfort is going to be different than your comfort, and it's going to be different than somebody else's comfort. So any patient is absolutely welcome to call us beforehand. And if they would like to do a curbside order and not enter the store, they are more than welcome to do so. That being said, I do want to make sure that it is absolutely noted that here at Columbia Care, we do ask that all of our patients wear a mask, and we do have masks at the door if you do forget yours. All of our employees are wearing masks. I currently do not have mine as I'm in the back by myself. But when we are on the floor, when we are dealing with patients all day, we are wearing our masks here. We have disposable and we have our Columbia Care masks, so there's no excuse for any of us to ever not have a mask on in here. We have hand sanitizers. We wipe down after every patient, and we have the nice plexiglass displays in between so that you have that nice little barrier. We do ask our patients to stand 6 feet away from the POS station, just so that we are using those social distance guidelines. But in any way that a patient needs, we can absolutely accommodate them. Now, you did talk about new patients in general, and that was something that I really wanted to touch on. With new patients, we really do try to make sure that we give them, just like every other customer, the utmost experience. With all of our patients, we want to make sure that every time they leave here, all of their questions are answered and that they feel like they are going home with all the knowledge that they need. We do give them a patient education packet. We do have a consultation room that patients are more than welcome to sit with us for any time necessary. And discuss even all the things that we've discussed here on this Facebook Live. They ask a lot of the same questions, but sometimes you still have to deal with breaking the stigma. You still have to deal with making them feel comfortable. So you don't necessarily have to talk about all of that in front of everybody else. We have a quiet consultation room that we can step aside and discuss which route or which vape, whatever it may be for your ailment, what will work best for you in the most comfortable environment.
Awesome. So why don't you share, let's share a little bit about Columbia and kind of your locations and where people can find you, and also talk maybe if there's some discounts available. That would be great.
Perfect. So Columbia Care is expanding every day. We just opened up our two newest locations. That would be Miami and Brandon. I am in Bradenton, and we are located in the plaza off of 14th Street, right behind Chick-fil-A and Mission Barbecue. And I say that because we're a little hidden. We don't really look like a dispensary, but we're here. Come and see us. We will.
It's a great store.
We're a little set back, but we're still here. We're in that plaza. And we offer some really awesome new patient discounts. Now, we do have monthly promotions that go on, but for a new patient, we offer two options. We have 20% off your entire order, or 50 off of $150. Now, we never want to pressure anyone into spending over $100 the first time they come and shop. So if you want to utilize your 20% off on your first purchase to kind of get an idea for how you like our products, you can utilize your 50 off of $150 within 30 days of your first time in.
Awesome.
And then I do want to touch real quick. We do have also discounts for our retired heroes, our 60 or wiser students, SSI, EBT, Medicare, all things like that.
I love that 60 or wiser. Yes,
60 or
I
wiser.
love it.
60 or wiser. Well put. And I just do want to touch on your vapes real quick, because I use it the same at night for sleep. And, every patient's different. But vaping for me at night, and even during the day, if I have a little anxiety, what's great about the vaping is I just hit your pen a couple of times and I'm good. I just feel myself relax. Yeah. So just to reiterate what you were saying, I'm a patient too. And obviously I'm a huge fan of that. So the vaping is different. And patients love to hear
like
their
that comes
doctors
from a
talk
commercial, Nicole. What is it? The commercial where I'm a user too. What is that? Do you remember? What is that? Do you remember? There was something. I'm old. So
no, but I'm just saying, relating back to vaping, that it absolutely changed my life as well, Maggie. So it's a huge game changer.
To realize that it's limitless. You know what I mean? It's
and
not
vaping isn't smoking.
It's for it really, and then it has its benefits. It's convenience. It doesn't have that much of a pungent smell like flower does. And then of course, as we've just reiterated multiple times, the onset is just what is fabulous about it.
Yeah.
You really are looking for that quick relief and something to really just take the edge off before you go to bed. You have that right there, and you can, like April said, or I'm sorry, like Nikki said, you could just take a couple hits off of that, and then you just go ahead and you instantly feel that relief. And it's nice to know that you don't have to wait for that relief. It's just a quick fix.
Yeah.
All right. It looks like we have a question. What routes do you have that other dispensaries might not have?
This is a good question, and it's kind of a little taboo, but again, as a patient, I will tell you that I love it. And the route that we have that I haven't found anywhere else is suppositories. They absolutely have helped so many of my patients who have Crohn's disease, who have IBS. I have a gentleman who has a colostomy bag. It really helps him with his stomach relief. I have patients who use them for endometriosis, for menstrual cramps. They are absolutely phenomenal, and there's something that people do get a little funny talking about when they come in here, but the reality of it is, guys, it's medicine, and it helps. We have it in our Eliseed, which is our 1-to-1 ratio, so you're getting that CBD in your body as well as the THC, creating that lovely entourage effect. And then we have them in the high THC. So if you're in a lot of pain, you have that option to not smoke anything, but you or take a capsule or take a tincture, but that you do have a root that can really get straight to that pain that some other dispensaries may not have.
Now, the suppositories work really well, I'm assuming, with hospice patients because of their inability to swallow anything. So suppositories are huge with patients that are bedridden, cancer patients, terminally ill. I think that's a great addition.
Yeah, and the onset for them is really great too. I think I see a question down there about the onset, and the onset is really great. I would say it's probably anywhere from 15 to 30 minutes, depending on how intense the pain is or what you're trying to relieve. But for me, it was a really, really just wonderful, calm body feeling. The relief from menstrual cramps and endometriosis for just a second. Like, it was just, and obviously not just a second, but in the grand scheme of things, it was just like, oh my gosh, I can take a deep breath and not feel pain for a little while. And it just is nice. Especially
for female reproductive system issues.
Yeah.
Absolutely.
And the great thing about it is too, that I really want to make sure everyone watching knows, and both of you ladies know, is that we are medicinal here, and we are strictly medicinal. So this isn't funny. It's not something silly to us. We have male, we have female patients. If you are, if you're not comfortable, we can absolutely set you aside with a female patient if you want to talk about something that is a little bit more uncomfortable. But all of our gentlemen are very well understood with them. They have used them as well because they are patients as well, and they can speak to their benefits as well. And so all of us here are ready to help you with a new route if you want to try it, but we can make exceptions if you feel a little bit uncomfortable, because it is a little bit of a new topic. Sure. We can definitely put you with someone who you would feel most comfortable with.
I love that. Love that. So thank you so much for all of that great information. Thank you for your time today, Maggie. Thank you, Nicole. Friends, so there is in the links in the chat, you're going to find all the information to direct you to Columbia Care, their discounts, as well as their social media. And for all of your medical marijuana certifications at MedWell Health and Wellness, we have offices in St. Petersburg, Sarasota, and Bradenton, and we also offer telehealth appointments. And for any questions that you have, please feel free to give us a call or stop by our website at medwellhealth.net. And we also have a great blog of information. So thank you so much for tuning in. And if you are catching the replay, feel free to leave a question. We will get back to you. And we look forward to seeing you in 2 weeks on MedWell Unscripted Florida. Thanks, ladies. Have a great afternoon or great morning.
Have a good one. Yeah.
I'm wishing the day away.
Bye.
Bye.
Have a great day, everybody.
See you Saturday.